Hi everyone, I am Jason Profetto. I'm the Chair of Clinical Skills, and this is the orientation video for MF3 Clinical Skills. So if you are watching this, it is because you've been chosen and selected as an actual preceptor for clinical skills in MF3. So what we're going to be doing is going through a bit of an orientation. We're going to be talking about what MF3 is. We're going to talk about what clinical skills is. And then we're also going to be reviewing some of the important details around clinical skills, teaching, professionalism, feedback, etc. So in the past, the feedback we've received is that the orientation videos end up being the most popular and logistically feasible because residents have busy call schedules and they're doing things, and to hold an evening session is a little bit tricky. And we know when we send out like PDFs or attachments that are long and lengthy with orientation material, it can be difficult. So hopefully the orientation video ends up working for most of you and you have a chance to view it and listen to it when you have a moment. So I have a laptop or an iPad beside me with just some of the content that I want to make sure I go over. So MF3 is going to be, so this is Medical Foundation 3, right? So the McMaster program is divided into two major sections, pre-clerkship and clerkship. Pre-clerkship is divided into 5 medical foundations, MF1, 2, 3, 4, and 5. MF1 is respiratory medicine, cardiology, and hematology. MF2 is GI, nutrition, and endocrinology. And then MF3 is a mix of renal-based medicine and reproductive or obstetrical gynecological medicine. So clinical skills in MF3 is going to focus more on the renal exam, the history around kidney-related pathology, the obstetrical history, the gynecological and sexual history, and then at the end there's going to be what we call some integration cases where we look at things that transcend several different MFs, so things like syncope, vomiting and diarrhea, and different types of edema, right? So in the pre-clerkship, as we were saying, there's 3 major components that are mandatory. Clinical skills is one of them, tutorials, which is twice per week, is another one, and professional competencies is the third. So professional competencies is the course that is Tuesday mornings between 9 and 12. It's every single week for the entire pre-clerkship. And it focuses more on professionalism, communication, ethics, indigenous health, and a couple of high-yield, very important topics. The tutorials are twice per week, and this is where the bulk of the actual content is discussed, and the students do most of their learning about the actual material in medicine. So they'll learn about kidney stones here. They'll learn about renal anatomy and physiology and acid-base balance disturbance, all that sort of thing. And then clinical skills is once per week, and I just want to be very clear about a couple of things here. So clinical skills is once per week, 2 to 3 hours, and it's a session. It happens every single week for every single MF. The preceptors for clinical skills are residents. So usually what we do is we choose 2 residents. We try to match them up as appropriately as possible. And between the 2 of you, you will be assigned a group of 7 or 8 students, depending on how large the groups are. So each week you will meet with these 7 or 8 students and you will do the teaching and go through the clinical examination that is assigned for that week, which is in the clinical skills guide, which we'll talk about briefly shortly. The focus of clinical skills, and this is a very important point because I think in the past a lot of people have gotten confused about this, is to really focus on practicing the history and physical examination with an introduction to diagnostic testing and diagnostic thought processing, right? So there needs to be a very heavy focus on history taking and physical examination. This is the part of the curriculum where it's very important for students to be able to practice, to get direct observation from their peers and from their preceptors, and also to receive feedback, even about like mechanistically, or even mechanically, how do you palpate, how do you auscultate, how do you percuss, these sorts of nitty-gritty details as it pertains to clinical skills. So in Medical Foundation 3, there's going to be 9 weeks in total. The first week is going to be an introduction and overview of clinical skills, especially in terms of expectations and self-directedness and how you want the sessions to look, how the students want the sessions to look. And we're going to go over the volume status exam. In session 2, the 2, 3, and 4, weeks 2, 3, and 4 is going to be a bit more focused on the renal examination, which is history and physical. And as you know, for a renal physical exam, it's very, very limited. But we're going to be talking about renal colic, hematuria, and acute kidney injuries, especially as it pertains to the important pieces of information in the history. Week 5 and 6 has an OBGYN feel to it. So week 5 or session 5 will be the obstetrical history, and session 6 will be the gynecological and sexual history. So these weeks as well are much more focused on history taking than physical examination skills. Sensitive exams, things like the pelvic exam, the breast exam, even the genitalia exam, are going to be done outside of the weekly clinical skills and with faculty on Wednesday morning. So it's a separate thing. So just so you know that it is going to happen in MF3 and MF4, but in this clinical skills weekly sessions 5 and 6, weeks 5 and 6 are going to be the obstetrical history and the gynecological sexual history, respectively. So in weeks 7, 8, and 9, these are what we call the integration weeks, where you look at things that are related to MF3, 2, and 1. So the first one's going to be on syncope, the second one vomiting and diarrhea, and the third one is on edema. Those are the themes, more or less. So what I'm referring to and what I'm reading right here is the clinical skills guide, right? So this is the guide that myself and students have created over the years, and we've had a few significant authors that have contributed a lot of time and effort to this. This will be available in the email that you're receiving from Andrea Payne, one of the administrators for MF3. All of the information you need is in here. So if you go to Medical Foundation 3, which says the dates from February to April, you will see that it has the MF3 clinical skills overview, like all the actual content that you would need, like the actual clinical exams and the details around that. And then it'll have the weekly session guide. So each week, and it'll tell you the exact agenda and what should be covered, right? So this is very important because I really want to ensure that most groups or all groups are having consistent sessions, and the delivery of the content to each group is similar right across the board. So it's very important to familiarize yourself with the guide, the content that's being covered. Make sure that you're comfortable with it more or less. There's a lot of resources here. So if you're ever unsure, you have something to refer to. You will have the guide that the students also have. So you have access to the same material. And often what happens is students will prep for these sorts of sessions by using the guide and reviewing some of the information. So MF3 clinical skills, it's renal and reproductive, 9 weeks. It's 1 session per week, 2 to 3 hours. And the agenda is right here, right? All of these questions, too, are going to be in the frequently asked question handout that you're going to receive in the email as well. Now, when you teach clinical skills, there's going to be a focus on history and physical examination, as we said. And the important part about this is that we do have access to patients so that students can practice on patients, right? There's 3 or 4 major groups of patients. So depending on the examination, it may be appropriate to examine fellow students. So we try to stay away from like the abdominal area, obviously more sensitive areas like the chest or breast and the pelvic region. But if we're examining a leg, lungs, heart, musculoskeletal joints, then it is appropriate. Even volume status, when you're doing examinations like that, it can be appropriate. So use your judgment and just make sure that we have proper orientation and consent for the students. We also have 8 hours of standardized patient access per group, per MF. So you can actually book standardized patients. We have an SP program where these patients are trained and oriented to be used as warm bodies. You can order cases where they come prepared with a history. And this is all going to be in the FAQ handout about how to book these. Each group has 8 hours, so I'd strongly recommend using and utilizing that. In addition to that, we have an agreement and partnership with St. Peter's Hospital where you can actually have access to real patients. This is more complex continuing care, so these patients have many comorbidities and medical issues, but they're vetted. We have an administrator that vets them and obtains consent and provides orientation and education to the family and to the patient about what teaching would involve if they are interested. And so if you book that, it's not that you're just walking around looking for patients. These are patients that are vetted, oriented, consent is obtained, and then you will be assigned the patient to teach with, right? And the last thing is that if you actually get real patients on a ward or in a clinic, you can do that as well. That is very appropriate and a very common option that a lot of people use. So if you're in a family medicine clinic, if you're on a ward, if you're in the emergency and you have a couple of patients that would be appropriate for teaching purposes, my strong recommendation is always to obtain consent and orient them about what the process is. Don't flood them for hours, but if you want to take a bit of their time and if you feel that the situation is appropriate, then you can use them. Now, as I'm going back here, the clinical skills guide we talked about. So feedback and direct observation is very important. So we really encourage that students are, as much as possible, directly observed each and every week by their clinical skills preceptors, and even if they get feedback from their clinical skills peers, right? Sometimes it's nice to have one of your peers watching you and provide some feedback before or after, but like the clinical skills preceptors, especially residents that are now in clinical medicine and practicing to a degree, you have a lot of pearls and wisdom that you can share with the students. There's going to be evaluations that are done. So these are initiated through MedSys. MedSys is our online software that organizes all of the evaluations. You will get prompted by email to complete a mid-unit evaluation and then another prompt by email to complete an end-of-unit evaluation. It is very, very important. I have to stress this, that due to accreditation reasons, these evaluations are done in a timely fashion and they are not prolonged or procrastinated to the point that we're beyond 1 or 2 weeks. When that evaluation comes up, I would really try to do it within a week or 2 weeks at the most. And remember, all evaluations on students should not come as surprises. They should have an opportunity to review this with you. You should be giving them direct observation and feedback each and every session so that they are well aware of where they stand and where they can improve. And I think feedback's very important. I think there's a way that we can deliver constructive feedback that doesn't insult or degrade what an individual is doing. I generally tend to have a very positive vibe to a lot of my feedback, even when it is a bit more negative or a bit more constructive. But it is important to give a few pieces of feedback each and every session to the students. And the students really thrive off this information and they really learn quite a bit from it. Now, of course, professionalism and like concerns about, if there's ever an issue where a student's like not properly dressed or not properly presented, or you're concerned about something they've said or something they've done to a patient, speak to them directly, provide them feedback, let them know how they can improve or address that situation in the future a little bit differently. If you're ever uncertain, just let me know. I mean, shoot me an email or give me a call and I'd be happy to navigate the situation with you. And I normally do that once or twice per MF with different preceptors. Diversity is a big thing too. So the standardized patient program is trying to improve its level of diversity. So that means we are recruiting all patients of all body types, skin colors, ethnic backgrounds, ability and disability, and from different communities. So we encourage all of our preceptors and clinical skills teachers to be well aware that diversity is a very important concept in medical education and clinical skills specifically. And just to give you an example of this, if I'm showing students an exam and I have a patient lay on an examination bed, I'll often pause and just do a brief moment about how sometimes when we expect a patient to lay on a bed, it may be easy, but there's other times when, for example, if someone has advanced Parkinson's disease or MS or CP, for them to lay on a bed can actually be very difficult, which means that you need to alter your exam real time to accommodate the patient and not put them in a dangerous situation, right? So that's one example of where diversity as it pertains to disabilities is important in organizing and orienting the clinical exam. And of course, things around draping and consent, these are hand washing, hygiene, these are all very important concepts that we should always be reviewing and reinforcing for our students. So that's the bulk of it. The students will get your contact and you will get the students' contact. I encourage everyone to connect sooner rather than later and start to organize the times that you're going to meet. Now, with resident call schedules and things that happen, it's understandable that week to week there may be some variation. Generally what happens is it ends up being between Monday and Thursday, late afternoon to evening sessions for clinical skills. But depending on the scenario, like it could be on a Friday or on a weekend if it really must be, just try to do what you can to be flexible, but also to be to function within your constraints as well, right? We can't bend over backwards too far without breaking things. So what I normally tell people to do is make sure that you're not interfering with any of the mandatory sessions like tutorials or professional competencies or other sessions. But if students have like social events or interest groups, like these things are not supposed to take precedent over clinical skills teaching. So we need to be able to draw a line and negotiate and navigate with the actual students. Between yourself and your co-preceptor, you have a lot of options. Like, so you can both attend every single week and split up the group. You can alternate weeks, so you do 1 week, your co-teacher does the other week. But just make sure that you're both in tune and updated on everyone's performance and you're communicating on a relatively regular basis. I didn't want to make this video go over 15 minutes. It's slowly creeping over 15 minutes. So my email is jason@profeto.ca. And in addition to this orientation video, you're going to receive a bunch of documents. Please go through them all and make sure you're familiar. Enjoy clinical skills teaching. This is one of the most enjoyed and liked parts of the curriculum for the students. And they see you as a role model. They see you as a mentor. It's a very unique relationship. So bond, show leadership, show respect towards patients, do your thing, be creative, follow the clinical skills guide, but you still have room for creativity and innovation in the ways in which you teach. So if you have any questions, let me know. Otherwise, thank you very much and enjoy your teaching.